Chemical exposure, meeting guidelines, goals. This safety session should teach employees to understand the potential risks of chemical exposure and to know the basic steps to take to reduce the chance of exposure. Number 1, exposure to some chemicals can cause health problems. Each chemical may present different health risks and different degrees of risk. Risk varies according to type, length of exposure, and repetition of exposure to the chemical. Number 2, identify chemical hazards and protective measures before you start a job. Read a chemical's container label and safety data sheet, SDS, to identify health hazards and what type of exposure is dangerous. Health hazards can range from rashes and headache to cancer or even death. Acute health effects develop quickly after exposure, for example, rashes. Chronic health effects develop after long-time exposure, for example, lung disease. Health problems may develop from exposure due to inhaling vapors or fumes. For example, dizziness, nausea, and breathing problems. Skin or eye contact, for example, rashes, allergies, and blindness. And swallowing, for example, stomach or liver damage. Wash your hands between handling a chemical and eating or smoking. Number 3, use personal protective equipment, PPE, to prevent chemical contact. The SDS lists the specific PPE that you need. Respirator to prevent inhaling the chemical, gloves to prevent hand contact with the chemical, eye protection to prevent splashes from reaching the eyes, protective clothing to prevent body contact with the chemical, select PPE approved for the hazard. Every job has different requirements. Inspect the PPE before use. Be sure it's undamaged and fits well. Don't wear contaminated PPE into an uncontaminated area. And remove PPE without spreading contamination. Dispose of PPE properly. Number 4, handle chemicals carefully to prevent spills, splashes, and releases. Report and don't use a chemical whose container doesn't have a readable label. Inspect chemical containers regularly for leaks and report any problems. Verify spill kits and proper absorbent materials are available in case of a release. Keep chemical containers closed when you're not using them, and take only the amount you need out of the container. Use chemicals only in work areas that meet the SDS ventilation requirements. Number 5, practice sensible hygiene and personal habits. Keep food, drinks, cosmetics, and street clothing out of areas with chemicals. Don't siphon chemicals by mouth, and wash thoroughly with soap and water after working with chemicals. Number 6, be prepared to take fast, proper action in an emergency. Clean up small spills or leaks immediately or report them if you're not trained. Wear the proper PPE during spill cleanup and dispose of waste correctly. Know whom to contact to handle large spills, releases, or fires. Know your evacuation route and take it promptly in an emergency. Get to fresh air immediately if you inhale a chemical, then get medical attention. Flush your skin or eyes with water immediately after chemical contact. Know the locations of the nearest shower and eye wash station. Remove contaminated clothing before you rinse your skin, and get medical attention after you've rinsed the contamination off. Get immediate medical attention if you swallow the chemical. Number 7, take chemical exposure risks seriously. Pay attention to safety training, follow all safety rules and job procedures carefully, and ask questions when you're not sure about a hazard or protective measure. Discussion point. Ask participants what chemical hazards they're aware of in their work areas and what they do to reduce their chances of exposure. Conclusion: you can reduce the chance of exposure to hazardous chemicals. Always know the identity and hazards of chemicals you use on the job. Follow safety rules and label and SDS instructions to reduce your chance of exposure. Chemical exposures. Don't eat or drink around chemicals. Protect against poisoning. Do you know which of the products you keep around your house are poisonous? Take this short quiz to assess your knowledge of poisonous products. Which of the following household products are potentially poisonous? Alcoholic beverages, ammonia, antihistamines, aspirin or aspirin substitutes, bleach, dishwashing liquid, cough and cold medicines, diet pills, garden chemicals, glass cleaner, glue, insecticide, iron supplements, laundry detergent, laxatives, lye, painkillers, rat poison, rubbing alcohol, sleeping pills, solvents and thinners, toilet bowl cleaner, vitamins. Answer: every item on the list and many items not included here are poisonous and under the right circumstances, especially to small children. In fact, a leading cause of accidental poisoning in children is the ingestion of iron supplements. To protect your family from accidental poisoning, follow these tips. Storing and handling products. Keep household products out of the reach of children and in locked cabinets. Leave all unexpired medicines in their original containers with labels intact. Throw out all expired prescription and over-the-counter medicines and containers on a regular basis. Throw out medicines that have crumbled or changed odor or color. Ask for and buy only medicines with safety caps. Keep non-food products, even vitamins, away from where food is stored or prepared. Avoid using products that contain lead or lead-based paint. Poison-proof behaviors. Never leave children unattended around household products, even to answer the phone. Always read cautions on labels. Remove old, peeling paint that could find its way into a child's mouth. Never use food containers to hold poisonous products. Don't give or take medicines in the dark. Teach young children to always ask you first before putting anything in their mouths. Even things that look good can poison you. In case of poisoning, keep the number of your local poison control center posted near all phones in your house. Keep syrup of ipecac on hand in case you need to induce vomiting. Seek medical attention immediately.